In this section, we'll be dealing with how do we basically determine the sex of the person from the skeletonized body remains. So in this section, we'll be dealing with the skull in particular. How do we basically determine whether it is a male skull or whether it is a female skull? The sex characteristics of the pelvis are discussed in detail because these are the mainstays, the skull and the pelvis. They have their own special characteristics for the sexing of the bones. Sexing from the sacrum and the long bones, it is also discussed in detail in this section. So these are basically the fragment, even we can have the fragments of these bones at our hand, or on the other hand, we can have a full stature of the bones. So in either cases, we have to establish the sexing of the bones. Now, basically, the accuracy of determination of the sex of the skeletal remains varies with the age of the subject, the degree of fragmentation of the bones, and the biological variability. So we can have decomposed bodies at our hand. And in those cases, we'll be dealing, how are we going to deal with the determination of sex of these bones? This is very important. And with the particular aging process, there are a lot of changes that occur in a normal male or a normal human skeleton. Those changes should also be kept in our mind. So the aging of the bones and the sexing of the bones, basically they go hand in hand to each other. It's not basically separate procedures. So the skull, moving on to the skull, if we have the skull at our hand and we have to distinguish whether it is a male skull or whether it is a female skull, how are we going to do it? The general appearance. Now, talking about the general appearance, in males it is more rugged, and on the other hand, the females have a more rounder and a smoother skull. Now, the size, it is larger with endocranial volume that is almost 200 ml greater, and the females have a smaller endocranial volume as compared to the males. Talking about the muscular ridges, now it is a general rule, whatever bone that we are discussing, the muscular ridges are more prominent in the males and they're less prominent in the females. Talking about the skull, it is more marked over here even, and especially in the occipital areas and in the temporal and the mandibular areas. So the muscular ridges and even the muscles are stronger in the males than in the females. That is the cause basically to it. Talking about the supraorbital ridges. So the supraorbital ridges are basically more marked in the males and they're less marked in the females, or even they may be absent in the females, the supraorbital ridges. Moving on to the mastoid process, it is larger in the males and it is smaller in the females. On the other hand, when we talk about the frontal and the parietal eminences, as all of the ridges, all of the prominences are more marked in the males and they're less marked in the females. So they resemble a shape of an infant in the males, the frontal and the parietal eminences, and in the females they are more prominent. Talking about the palate, it is larger and more U-shaped, and it is smaller and it is tend to be parabolic in the females. When we move on towards the orbits, it sets lower on the face and they are more square and they have less sharp edges, while on the other hand, it is more rounded in the females. Glabella is basically it is a marked prominence just above the nasal bone, and it is more marked and orbital margins are rounded and they're less sharp in the males and then in the females. The nasal aperture, when we are talking about the nasal aperture, it is higher and narrower with sharp edges, and the nasal bones, they are larger and they project forward to meet at a more acute angle. So this is basically, we are starting on towards even, there are particular peculiarities towards the male and towards the females, and we are moving them, we are dealing with them one by one. Regarding the forehead, it is high and steep with a more rounded infantile contour in the females. So talking about the zygomatic process, it is the posterior ridge projects back beyond the externally auditory meatus, and the zygomatic arches bow outwards. The zygomatic arches remain more medial in the females on the other hand. Now talking about the nuchal crest, it is more pronounced in the males than in the females. So when we are talking about the mandible, it is basically, the mandible is discussed, basically it is of high importance while we are aging the bones, but even in the males and the females, there's a significant difference. It is larger with square symphysis pubis in the males, and the jaws are more rounded in the females on the other hand. So the sex characteristics in the pelvis. So the pelvis, on the other hand, is also a mainstay while we are sexing the bones. So we have to keep in our mind the differences basically that are encountered while we are sexing the pelvis. Are due to the fact that the females have to go through the process of childbearing. So all of these characteristics, all of these differences, it's basically a mainstay. How do you remember these differences? Because the female has to go through the process of childbearing in pregnancy, of course. Now, the post-pubertal female pelvis is wider and shallower than the rather upright male girdle. So this is basically, we are distinguishing it from the post-pubertal female pelvis, not the pre-pubertal female pelvis. We have to keep that in our mind. The male pelvis is more rugged because of the attachments of the stronger muscles, and it stands higher and more erect than smoother, flatter, and female pelvic girdle. So basically what is happening here is the same general rule that is applied to all of the bones. It is more rugged, the muscular ridges are more prominent. All of these we have to keep in our mind. Now the subpubic angle, it is very important. It is almost 90 degrees in the female pelvis and is usually less than 70 degrees in the males. Again, the childbearing process, the females have to go give birth to the children. So this angle is basically a bit larger in the females than in the males. So moving on to the pubis specifically, when we are talking about the pelvis, the body of the pubic bone tends to be triangular shape in the male, and the female pubis is more rectangular. Sexual variations in the pubis of the females. Now, there are certain variations, of course, from person to person, even in the females themselves. A bony ridge, a vertical arc running down vertical surface from the pubic crest, of course, and then the concavity of the lower margin of the inferior pubic ramus, that is also very important, immediately lateral to the lower border of the symphysis. So, we can have a vertical ventral arc at one end, and then we can have a concavity of the lower margin of the inferior pubic rami. So that is basically a difference that we have to keep in our mind. Then the ridges of the elevated bones on the medial aspects of the isquiopubic ramus immediately lateral to the symphysis. So there can be ridges in some cases. All of these are basically the post-pubertal changes that occur in the bodies of the females, and we're not talking about the pre-pubertal changes. So that has to be kept in our mind. Now the isquiopubic index. So this is calculated, it is devised by Washburn, and it is calculated by the pubic length divided by the ischial length. So in males it is less than 90, and in females it is more than 95. Now, acetabulum is larger in the males. It is 52 millimeters in diameter compared with 46 millimeters in the females. The greater sciatic notch, deep and narrow in the males, wide and open in the females. The obturator foramen is ovoid in the male and the triangular in the female. The preauricular sulcus, well marked in the females but is absent in the males. And the pelvic inlet, when we are looking from it from above, it is more circular in the males, and on the other hand, it is heart-shaped in the males. So the sex characteristics in the sacrum. In the females, the sacrum is wide and has a shallow curve. It is shorter in the female, and the curve is limited almost entirely to distal part below the center of the third sacral vertebra. While on the other hand, in the males, the sacrum may have more than 5 segments, which is rare in the female. The curve in male is continuous down whole bone, and there may even be a slight forward projection of the coccyx. So even the long bones come in hand whenever we are sexing the bones. The humerus, for example, in these tables, as you can see, it is the Dwight's table for sexing from the humeral and the femoral head diameters. And whenever we compare, it's basically the transverse humeral diameter, the vertical humeral, and the vertical femoral diameter. So there is a difference in them, all of that, if we are comparing them. and we can sex the bones through these tables as well. Then there is another table which is known as the Pearson and Bells table for mathematical sexing of the femur. The vertical diameter of the head is compared with the popliteal length and the bicondylar width. They can also be compared in the males and the females. And the oblique trochanteric length, it can also be compared in the males as well as in the females. So in this section, basically, we dealt with how are we going to proceed with the sexing of the bones and how is it established with certainty. That is the end to this section. Thank you for watching sqadia.com.